Right now, we're here in Freeport, members of the surveillance unit, inclusive of physicians, nurses, and current contact tracers, because we're looking to upgrade them from contact tracers. But the team is here basically, we met with the Grand Bahama surveillance branch here on the ground, looking to strengthen their network with their stakeholders. We understand that surveillance here, they know what to do, but the challenge has sometimes been with that stakeholder communication, making sure persons are aware of their relation to surveillance, to public health, how important, significant their role is, and to be certain that they understand who they need to communicate with, who they need to connect to, and how to be as efficient as possible with responses. Okay, for the first 3 days that we were here, we basically had presentations made by members of the unit, the Grand Bahama Health Surveillance Team, and stakeholders here on the ground, specifically from DEHS, Water and Sewage, and Immigration. And the whole purpose of those presentations were to elicit discourse as to identified gaps in communication, anything that needed to be augmented in their system, how the ministry could possibly assist with them augmenting what is in place. Because the whole point is to bring public health, surveillance, and preventive medicine, preventive practice to the level where we would like for it to be, especially considering Grand Bahama is going to be expanding.
I would have done 2 presentations for the workshop. My first presentation was on public health notification, so the importance of notifying when it comes to reportable diseases, all of the communicable and infectious diseases, and also our international reporting responsibilities. My second presentation would have been on vaccine preventable diseases, how to investigate them, how to recognize them, and again, the importance of reporting them so that we can get ahead of them.
So I would have spoken on a crash course, if you will, on epidemiology. As we're bringing awareness to public health, we want to make sure that all of the language and terminologies that we're using are no longer strange to anyone, even if they've heard it before. It makes a little more sense. And I also would have gone in depth as it relates to foodborne and waterborne illnesses, specifically how we conduct those investigations from start to finish in terms of what happens at the point of care, so that our stakeholders on the ground know exactly what their role is. And from there, when it comes on our end, what we do with their information to ensure that everything is accounted for.
It is most important for us to have workshops like this with all of these agencies and also with different surveillance units in our archipelago. Why? We all need to be on the same page. We are working towards the same end strategy goal, and we can only accomplish it if all of the information is shared to all parties and that we are all communicating, meaning sharing information and also doing what we need to do.
For us in law enforcement, we have to devise a strategy as to how do we protect not just the migrants coming in and those of us who live and call this place home, but how do we also maintain the migrants' rights based on the law? Because the law did not go away during COVID. We still had to notice that we could not withhold the persons from a court system without due process for more than 48 hours, or 72 with the Supreme Court's permission. So how do we manage all these kinds of things under a condition of a lockdown society, a lockdown world, if you please? And so what we thought best to do, along with you and the Ministry of Health, was to seek to understand what were the issues that we would encounter if, for example, persons would come to us from through the U.S. Coast Guard. They bring us most of our, I say, Hispanic persons who would seek to flee their homes for a better way of life.
I'm Dr. Shailesh Hegde. I'm registrar at the Disease Surveillance Unit. We also cover port health, and I work for the Grand Bahama Health Services, and we work in collaboration with the National Surveillance Unit under the Ministry of Health. We also work with immigration, customs, environmental health, tourism, and other agencies in the course of our duties. So today I'll be talking about illegal landings, of which you had a very good information already from Officer Gibson, and I thank him for doing that at a very short notice. So let's start with the presentation. This would be on public health rapid assessment.
The workshop was important to strengthen our stakeholders and our healthcare providers alike so that we are all aware of the roles and responsibilities we play as we respond to a public health threat.
During this session, I presented on the purpose and objectives of why it is that we're here. And I just wanted to underscore the importance of teamwork and building alliances with our stakeholders, making sure that everyone is aware of the protocols and policies and the expectation of the surveillance unit, making sure that everyone realizes that they're a part of the puzzle and we have to come together to mitigate any gaps that we've identified. And we need to also make sure that everyone, is aware. And we just wanted to bring that awareness forward, as well as I wanted to underscore the importance of collaboration among the stakeholders. And coming out of this, we wanted to have concrete plans as to how we will mitigate any gaps that we've identified.
As the National Immunization Coordinator, one of my job functions is to ensure that each clinic facility that administers vaccine is adhering to the cold chain standard and the documentation process for immunizations. So I went from clinic to clinic to ensure that the nurses who work the clinic are actually ensuring that the vaccines are kept at a constant temperature so that they remain potent or viable until the time of administration to the clients. And then we would have gone through their clinic notes to assess their documentation process to ensure that all of the vital information that is needed for recording of the immunizations is actually on file and on paper.
Yesterday was a fun day in that we actually went out with DHS. We actually got to see them working in the field, see the various areas they monitor. We saw out of commission pools, tire stores. We went to, there's a facility that had some man-made waterways, seeing how they're being maintained. They're using fish to keep mosquito populations down. A lot is happening here in Grand Bahama for those who may not be aware. It's a very functional public health surveillance system with good collaboration between the stakeholders. It's just about making sure everything is in place as it needs to be. And as we take Grand Bahama as a country forward, expecting more touristic population, expecting more to be happening here to make Grand Bahama vibrant and beautiful again, we just want to be prepared to take it on. We just had a meeting today with hoteliers. We're not leaving any stakeholders out. We want to make sure that everything is in place from a public health perspective, that we keep our country safe, we keep our visitors safe, and we remain a beautiful #1 destination.
Okay, so this type of workshop is very important. It's important for us to do it often. One, because we have a high staff turnover, so we want to make sure that our persons are aware of what their responsibilities are, not just within the Ministry of Health, but with our other stakeholders as well, because protecting health is not just a Ministry of Health responsibility, but it's a responsibility for all of us who serve the Bahamian people to protect our population.
I think it is an important tool that we have at our access where we can look at where it is that we are and identify strategies to make sure that we're doing what it is that we're supposed to be doing, making sure that everyone is on the same page and we are protecting our communities and making sure that they're not exposed to any outside threats that may put them at risk.
So the work of public health is not work that can be done in isolation. For whatever outbreak you may think of, any public health situation, you would need several parties involved. And even though we have several of those parties in existence in New Providence, being an archipelagic nation, our great country is not solely just the capital. And so saying that, Grand Bahama is no exception. And so having all of the stakeholders from environmental health to immigration, even having the hoteliers on board, we understand that all of these persons play a role. And so I'm happy, one, that we are able to now bring awareness. And we're hoping that we can heighten that awareness with any consecutive visits that we're able to have, but also that there's an interest. So that means that now we can move from persons actually attending to actually wanting to be a part of this collaborative effort. And I think that will definitely make the difference in terms of getting where we need to be.
They're going to be getting another cruise port. They're going to be getting more freighters. There's a port health component of public health that Grand Bahama needs to have that support with. What I best thing about this trip, it wasn't so much the presentations. There were outside meetings. We had the opportunity to meet with the administrator of the Western District, and that was a very fruitful meeting with Mr. Dames. We're actually invited to come back to help with community outreach and to see how we can assist with getting persons trained in terms of outbreak response, lay persons, to give assistance to Grand Bahama here on the ground. We met with the EMC here at Grand Bahama. That was, again, another fruitful discussion. Again, looking at ways forward, supporting the health surveillance team on the ground, ensuring that across the island, the communities are aware of the role that they can actually play themselves in terms of public health, improving and getting the messages out for buy-in, not just from stakeholder level, but from the public.
And so it's very important for us to host these annual updates, and so that we can ensure that our stakeholders are or stay current with whatever is going on, and also for our healthcare providers, as we have new healthcare providers every year, as in new nurses, new physicians, and so everybody has to be on the same page with what is happening currently and if there are any new updates that they need to be aware of as we collaborate to keep our country safe.
Brought to you by the Ministry of Health and Wellness.